Thank you.
Okay, good evening, everyone. We're going to go ahead and get started. So thank you for joining us tonight. This virtual education program is brought to you by Cancer Support Community South Bay. I'm Nancy Lomibow. I'm the program director, and tonight we'll be talking about GI side effects of non-small cell lung cancer, and Dr. Horodner will be presenting. And before we begin, if this is your first time joining us, we want to welcome you and let you know that we're a premier nonprofit organization providing emotional support, education, and hope for people affected by cancer and their loved ones. We serve the South Bay, Long Beach, and Orange County, all at no cost. And our programs include support groups, networking groups, healthy lifestyle classes, social activities, and educational programs just like this one. Tonight, our program is funded by a grant. It's part of our Frankly Speaking About Cancer. And one of the things that we do need back from all of you, just as an evaluation that Rebecca will be sending to you after the presentation to complete. So if you do that, we'd be so grateful. If you want to visit our website, we're at cscsouthbay.org. And now, without further ado, I want to introduce our workshop speaker. So Dr. Andrew Horodner is a board-certified hematologist and medical oncologist at the Hunt Cancer Center at Torrance Memorial Medical Center. Dr. Horodner has been a longtime member of the Professional Advisory Board here at Cancer Support Community, and he holds several leadership roles at Torrance Memorial and its affiliation, which is Cedars Sinai. These include chairman of the Lung Cancer Tumor Board, chairman of the Oncology Committee, and co-medical director of the Thoracic Oncology Program. He and his team are also highly involved in clinical trial research across multiple hematology and oncology disease types. So welcome, Dr. Horodner, and thank you so much for being here tonight.
Thank you, Nancy. Appreciate that. Happy to be here, and thank you for joining us. You guys can hear me okay?
Yes, thank you.
Okay, perfect. So tonight I was asked to speak as part of this Frankly Speaking About Cancer series, focusing on gastrointestinal side effects of non-small cell lung cancer treatment. So that's me. You can see me. I have no financial relationships to disclose. So Cancer Support Community uplifts and strengthens people impacted by cancer by providing support, fostering compassionate communities, and breaking down barriers to care. And I've been honored to be a part of this group as part of their professional advisory board, I think about 14 years now. And these slides were reviewed. So workshop disclosure, you can see the statement here that the content was reviewed and that the Cancer Support Community has control over the content. It's sponsored by Mirati Therapeutics. So in terms of our overview for tonight, first we'll give some introductions. We'll talk about non-small cell lung cancer. What is it? Understanding treatment options for it. And then delve into the kind of the meat of the talk, which is the gastrointestinal system, discussing what it is and how cancer treatment affects it, specifically looking at gastrointestinal side effects, also talking about other side effects of treatment, and then giving you some guidance as to how your care team can help get you through the the side effects and just navigating through your cancer journey. And then at the end, we'll have time for questions and answers. So what is non-small cell lung cancer and how is it diagnosed? You can see here that non-small cell lung cancer makes up about 80 to 85% of all lung cancers, and it's made up of three types. The most common is adenocarcinoma, and that accounts for about 60% of these non-small cell lung cancers. And this type can be related to tobacco, but does not have to be. Squamous cell carcinoma used to be the most common many years ago when I was in my training, but now only accounts for less than 30%, and this is the one typically associated with tobacco. Large cell carcinoma is not as common, less than 10%. And then other cancers, small cell lung cancer, mesothelioma, or other types of lung cancer. The stages of non-small cell lung cancer are listed here. So stage 0 indicates very early encapsulated cancer that really hasn't broken through the basement membrane of the region where the tumor is. Stage 1 is broken down into subtypes 1A and 1B. These are typically considered invasive cancers, but they're small and they have not invaded the lymph nodes. As tumors become stage 2, these cancers typically have lymph node involvement, usually the hilar lymph nodes, which are the more peripheral lymph nodes that are in the lung. And lymph nodes, we all have them. Just to remind you, these glands in our neck get swollen when we get sick. Those are lymph nodes. But these lymph nodes are throughout our body, and unfortunately, they're a way that the cancer can get into the system and spread. So the more peripheral lymph nodes, if those are involved, typically stage 2. Stage 3 cancers are defined by more central lymph nodes in the center of the chest, called the mediastinal nodes. Also, as the tumor size gets bigger, bulkier, gets more advanced, where it starts spreading into adjacent organs, the tumor gets higher in stage. Stage 4 lung cancer is unfortunately metastatic, where it's not curable, and this typically involves cancer that has spread to distant organs like the bone or the brain or the liver. So then, talking about non-small cell lung cancer treatment side effects, what is a treatment side effect? Well, basically any unintended condition that occurs as a result of therapy. So, and that's pretty broad. Different cancer treatments can have many different side effects depending on whether you have infusional chemotherapy or immunotherapy or pill therapies that target certain mutations, or radiation or surgery for that matter. Everyone experiences cancer treatment and their side effects differently. So what are some possible treatment side effects? Well, non-small cell lung cancer can cause different issues for different patients. It can decrease strength or mobility. So some patients will become specifically fatigued in their muscles and have their nervous system affected. So some people can develop something called peripheral neuropathy, which is associated with some chemotherapy agents like cisplatin or paclitaxel. And these drugs can be toxic to the nerve tissues, and they can cause people to have sensory loss and have difficulty with balance, sometimes pain. Sometimes people can have motor dysfunction where they have difficulty with strength. Some treatments can cause pain, but typically we're trying to implement these therapies to treat pain. Fatigue and tiredness are very common side effects from chemotherapy, radiation treatment. Skin and nail changes where the skin can get broken down, where you can kind of have a sloughing of the skin of the hands and feet, changes around the nail beds called paronychia. These are more common with some of the oral lung cancer treatments that we give, the so-called EGFR inhibitors like Tagrisso is one that can cause those skin and nail changes. And then gastrointestinal side effects can be common in certain types of lung cancer treatments. Chemotherapy, absolutely. Immunotherapies that we give can also cause diarrhea. And some of these targeted oral therapies that we give similarly can cause diarrhea, nausea, that type of thing. And we'll delve into that further. So the gastrointestinal system, just as a review, it begins in the mouth, and that involves the lips, the teeth, the tongue. The salivary glands are in this region, and that's where saliva is secreted, moistens the food. It has enzymes which help start to break down the food. And then the food goes down into the more specific lower part of the GI tract, or lower down in the GI tract. So your esophagus has a mechanism of pushing down the food into the stomach. This is called peristalsis. And your muscles contract. Digestive fluids that end up getting secreted in the stomach and in the small intestine and in the pancreas and other places secrete enzymes that break down food further. So, and this kind of talks about it a little bit further. The small intestine has enzymes and bile, which is from the gallbladder, to basically break down the food bolus into its sort of constituent components like carbohydrates and proteins and fats. And your body breaks them down and is able to absorb them and take them through the blood to the organs where they need to go for energy and other metabolic purposes. As the food and what's remaining traverses into the large intestine, this is where we want to resorb the water and the electrolytes so we don't get dehydrated. And our body is effectively doing this and separating the water from the residual food, which at this point is just a waste product, as most of the nutrients has been absorbed. And then in the rectum and the anus, we have a sphincter there that helps us control our bowel movements so that we can store the waste until we are ready. So gastrointestinal side effects of treatment, these can involve changes to sense of taste and smell. Commonly, some chemotherapy agents can cause changes in the taste buds, sensitivity to different smells. Then we'll talk about kind of management of that. Mouth sores are fairly common toxicity from chemotherapy, as well as some of our oral targeted therapies. And this can happen via different mechanisms that the treatment can break down the mucous membranes in the mouth and the gums and in the cheek lining. Also, people can get predisposed to viral or fungal infections, which can further cause problems in the mouth and cause this irritation. When patients are being treated with systemic therapies that suppress the immune system, their blood counts go down, specifically the white cells, and patients can be predisposed to infections, bacterial infections, sometimes viral and fungal infections. Nausea and vomiting are the classic chemotherapy side effects that people think of when they're taking these infusional treatments. And chemotherapy basically affects very rapidly dividing cells, which are in your GI tract. That's why we seem to sort of frequently see these kind of toxicities there. It affects rapidly dividing cells in the hair. That's why people have hair loss. Rapidly dividing cells in the bone marrow. That's why people get low blood counts. We have very effective anti-nausea medicines that we give today that weren't like this 20 or 30 years ago, where we're very good at preventing nausea, vomiting, but sometimes people still get it, and we have pills that they can take at home. Chemotherapy and other treatments can cause problems with diarrhea and constipation. Some of the oral therapies for lung cancer can commonly cause diarrhea. Constipation can be due to chemotherapy toxicity, can also be due sometimes to opioids or pain medication that people take. Weight changes are common, sometimes due to just being run down and fatigued, patients having loss of sense of taste and smell, mouth sores, nausea, constipation. You can see how all of these things might impact a patient's appetite and ability to want to eat and to be able to digest food. And commonly people will lose weight. Sometimes cancer can break down, catabolize is the term, kind of our tissues, and that can cause weight loss. Some patients will have weight gain, and this is with certain treatments which can cause fluid retention. Certain chemotherapies can do that. Loss of appetite, I kind of talked about already. So cancer treatment can also cause mouth and throat changes. Some of this has been discussed already, so I'll kind of go through this. Pain or swelling in the mouth or throat we kind of talked about already, but that can happen sometimes when we're talking about lung cancer. Typically radiation is given to the chest, but with other cancers, if you have radiation higher up, you can have pain or swelling in those regions. Sensitivity to hot and cold foods can happen, and sometimes chemotherapy can trigger that. Difficulty swallowing, so-called dysphagia, can be an issue for different reasons. Sometimes the tumor can compress on your esophagus. Sometimes treatment can cause that peristalsis, where the muscles kind of push, to slow down. Tooth decay due to issues with chemotherapy affecting the flora in the mouth, the normal flora. Other bacteria can overgrow because our immune system is suppressed. And then as a result, tooth decay can occur. Oral thrush or yeast called candida or candidiasis can often appear as a white kind of plaque, white coating on the insides of the cheeks, in the throat, and this can happen with cancer treatment and immunosuppression. So what can help? So when we're talking specifically about nausea and vomiting, I've alluded to it already, but medications. So we have very effective antiemetics or anti-nausea medicines. Frequently with chemotherapy, we'll give different classes of drugs that block different pathways. Nausea is a complex system that is triggered by the brain. And if we target some of these sort of brain transmitters, neurotransmitters with different drugs, we can block nausea via different mechanisms and be effective at prevention, but also treatment. And there are so-called neurokinin inhibitors like emend. There are the so-called 5-HT3 drugs, serotonin mechanism like Zofran or ondansetron or Kytril or granisetron are common versions of that. Acupuncture or acupressure can sometimes be quite effective for nausea. So we encourage our patients to take advantage of these tools where specialists can apply acupuncture, and nausea has been shown in clinical trials to dissipate significantly. So I definitely recommend it. Sucking on ice chips or popsicles can frequently help with those symptoms. Drinking flat soda, not carbonated at that point, can help. Eating blander foods, toast, crackers, gelatin are some options listed there, pasta or rice. And then avoiding, if you're really feeling sick to your stomach, kind of common sense not to eat things that are spicy or strong or fried that's going to upset your stomach. Really focus on blander foods. Sometimes ginger products can be useful. I don't know that it's particularly controversial, but marijuana products can sometimes be helpful. What else? So for sore throat, sore mouth, again, kind of delving into that further, make choices that are easier to swallow. Try to soften the foods or liquefy them with gravy or sauces to make it easier for your body to break it down and easier for you to swallow and digest. You know, common sense, avoid foods that cause discomfort. So if something's crunchy and it's going to hurt your throat, spicy, salty, sour, some of these things trigger pain via different mechanisms. Your mucous membranes are broken down by the chemo and the other treatments. And so introducing some of these acidic or very salty or spicy foods can sometimes trigger pain. Sometimes avoiding certain fruit juices that are high in acid is a good idea. Alcohol and tobacco products in general can exacerbate sometimes sore throat, sore mouth. They can exacerbate reflux. People can have heartburn. Acid can come up and further cause problems from drinking excessive alcohol or caffeinated products. For dry mouth, drink plenty of fluids, keep water on hand. Some people will use gum. Some people will use sucking candies, also being alert of not taking in too much sugar, but they have lower sugar versions of those products. Nausea, This is a sick or unsettled feeling in your stomach, like you feel like you may have to throw up, which is vomiting. Constipation means difficulty going to the bathroom, difficulty having a bowel movement specifically. And different issues, medical issues, can exacerbate constipation. Surgery can slow down the gut via having anesthesia and your bowel just kind of going into a quiet mode. Being inactive can slow down the gut. Being dehydrated, as I mentioned earlier, pain medications, specifically opioids that you take, like morphine products, Vicodin, can slow down the gut and promote constipation. And some cancer therapies can cause constipation, chemotherapy, some of the oral therapies too, but not as common. What can help? Well, it's always good advice to talk to your healthcare team, whether it be the physician, the nurse practitioner, the nursing staff, your nurse navigator, anybody that can help you, talking about supplements that might be useful, laxatives, stool softeners. It's always good to have some guidance before you take new treatments so that you know what's safe and what to expect. Sometimes changes to your diet and changes to your exercise routine can be helpful. Eating foods that are more promoting of bowel movements, prunes, that type of thing. Making sure you're drinking adequate fluids to keep you hydrated. Warm drinks, fruit juices sometimes can promote bowel movements. Sometimes higher fiber foods can be effective. And then exercise, activity, as mentioned before, can often help your gut start to move again and help promote bowel movements. So on the right side of the slide, some of these things are general, advice, but when is it really more of an emergency? Well, if there's more significant pain, if there's no bowel movement or significant cramping for more than 2 days, I think is generally good advice. At that point, should probably touch base with the healthcare team and make sure that nothing more serious is going on. A bowel obstruction or an ileus, which is a slowing down of your intestine, can happen and sometimes needs to be assessed with a CAT scan. Patients may need to be hospitalized, may need to have a nasogastric tube put down into the stomach to help aspirate out fluid contents if there's a true blockage in the intestine. Diarrhea, the reverse problem, can happen with frequent loose or watery bowel movements. I think that should say what can cause diarrhea: chemotherapy, drugs, immunotherapy drugs. So some of the drugs that we use commonly, Keytruda is one, Opdivo is another, Imfinzi is another. These are immunotherapies that we use in lung cancer. They can cause an autoimmune attack on the gut and cause significant diarrhea, which can actually be quite life-threatening in some cases. So it's really important to be mindful of that. It's not a minor diarrhea, it's a severe diarrhea and needs to be addressed aggressively with sometimes antidiarrheals in addition to fluids, in addition to steroids. Targeted therapies that we give, the common EGFR inhibitors like Tagrisso and Tarceva cause diarrhea. These can be managed with antidiarrheals. Radiation treatment can cause diarrhea. Not so much for lung cancer, because it's higher up in the GI tract, but radiation to the abdominal cavity can. Infections. So important to note that just because you have watery bowel movements doesn't mean it's a side effect of your treatment. You could have a concurrent infection, and sometimes the stool has to be tested for that, and sometimes you need an antibiotic to treat it. So it's important not to guess. These issues need to be addressed with the healthcare provider so that we can sort out what we think is causing the problem. Surgery also. So I kind of alluded into some of this already, but talking to the team as before is a good idea. before you take any kind of anti-diarrheal drug. Pepto-Bismol can be effective, but should be discussed. Imodium, Lomodal is another that's not over the counter, it's prescribed, but these are anti-diarrheals that can be effective for treatment-related diarrhea. Fluid hydration is important. Ginger ale, sports drinks, clear broths, avoiding caffeine, particularly coffee, that can promote bowel movements, best to avoid because you don't want the bowel movement, and it's a diuretic, which can cause you to lose more water and get more dehydrated. Avoiding certain extremes, hot and cold, can sometimes exacerbate bowel movements. Alcohol should be avoided. Alcohol also has diuretic pro-diuretic properties, which can make you dehydrated. Eating smaller meals that are low in fiber is generally a good idea. The brat diet that we discussed, bananas, rice, applesauce, toast, can be helpful. Blander diet, bulking up the stool a little bit. When to seek emergency attention. If you're having more than 3 episodes of diarrhea in a day, probably reasonable at that point to call your healthcare team. Part of it also depends on what you were advised in the first place. Part of it depends on the severity of the diarrhea. Diarrhea is profuse water. A looser bowel movement is not diarrhea. It's just a looser consistency of the stool. And it's critical to get on top of really watery diarrhea because you can lose a lot of volume and get dehydrated. Blood pressure can drop. You can develop other problems like kidney failure. So it's important to take it seriously. Weight changes are common during all times, before treatment, during treatment, after treatment, can be attributable to the cancer itself, to new medications that you might take, having surgery, physical activity, and just your emotional state. And I think it's good advice focusing on nutrition and physical activity throughout your whole cancer journey is important to keeping you on track. So what kind of foods should we use when we're having weight changes during our treatment? Well, I think this is also an important point. Consider speaking with a nutritionist or a dietitian. In general, we try to, particularly for patients that are going to embark on systemic treatment, chemotherapy or otherwise, we try to have those patients meet with a registered dietitian with a background in oncology so that he or she can have an upfront discussion about being proactive and preventing weight loss and eating foods that are more nourishing to allow the body to heal and to be able to withstand the therapy. Non-small cell lung cancer and its treatments can affect eating and digestion and metabolism, as we've talked about. And foods that an RD can discuss with you can be helpful to meet your needs, to make sure that you're nourished and that your weight is maintained. So here are some helpful hints, I think, for managing weight gain on the left or weight loss on the right. So, and some of these are common sense, but I think are good to review. For weight gain, eating lower calorie fruits, non-starchy vegetables, high fiber whole grains, fairly common sense. Avoiding higher calorie foods with creamy sauces, cheeses, oils, fried foods, typically avoiding the things that taste good, but and it's not to say that you can't have things in moderation and on occasion. We try not to deprive people, but obviously if weight gain is a problem, it should be modified. Choosing baked or broiled lean meats like fish and chicken and turkey, and limiting beef and pork, which in general is probably better for health, period. Avoiding sugar-sweetened beverages, baked goods, processed foods that really, again, some of them taste good, but they don't really offer much nutritional value. Conversely, for weight loss, you want to do the opposite. You want to eat higher calorie foods, can have higher calorie fruits, can have some starchy vegetables, that type of thing. Avocados, olive oil, nut butters, these are really healthy choices that can help you gain weight. Foods that are higher in protein are important, and that's a key thing. Because people often get cachexia and muscle wasting from the treatment and from the cancer itself. So whatever we can do to build back muscle, I think is important. And these high protein foods include meat, which is the obvious, but nuts, beans, fish, eggs, and dairy. So we can, even if for people that are vegetarian or vegan, we have many healthy choices that are good for us and that are appropriate for the patient's diet. Weight changes in terms of using physical activity. The best thing that you can do with respect to your maintaining your weight or getting to the ideal weight is regular physical activity. If you can do 15 to 30 minutes of moderate activity daily, that would be a goal. And I think it's important to tell people that don't expect that that's what you're going to do from time point A if you're not doing it at all. If you can do 15 minutes, 2 to 3 days a week to start, I think it'll make you feel better and give you some confidence. And I try to just, reinforce that with my patients that we're here to support them. We try to be cheerleaders, and you don't want to set expectations too high because then it's easier to fail. It's better to start slow and work your way up. Find a friend or family member to be active with, I think, is always good, keeps you motivated. If you're feeling not in the mood, sometimes your activity mate can kind of twist your arm a little bit. Asking the Cancer Center about physical therapy programs, and we have an excellent physical therapy, occupational therapy team that can work with our patients for different issues. Before making any changes to your physical activity regimen, again, talk to your team. Supportive services. So nutritional counseling, I think, is important. We talked about having a registered dietitian who's an expert, can communicate with patients at the beginning, not after they've been going through something for months and months, but it's never too late. An RD who has the CSO letters is board certified in oncology nutrition, and meeting with the dietitian regularly can be helpful. At Torrance Memorial, for example, we have dietitian classes that are online and dietitians that meet with patients that have general classes on a monthly basis, but also individual appointments. Palliative care. This focuses on providing cancer patients with palliation or relief from their symptoms. And these symptoms can include pain, psychological stress or distress, or other symptoms, shortness of breath, fatigue, that type of thing. The goal is to improve the quality of life for both the patient and the family. And it's provided by a team of healthcare professionals who work together with the oncologist and the primary care doctor to give an extra layer of support. It's appropriate for all patients at any age, at any point, and it should be done concurrently with the treatment. And we are quick to get the palliative care team involved, and I think patients really appreciate it and benefit from it. Some patients get worried that palliative care means that they're going on hospice, and that is absolutely not true. There is a continuum. Hospice is for patients at the end of life. Palliative care is for patients that need symptom management and support. Rehabilitation, we've delved into a little bit. An occupational therapist works with more of the fine motor skills, where a physical therapist perhaps works more with the bigger muscles, but both work with improvement of mobility, dexterity, strength. A respiratory therapist, particularly for lung cancer, can be useful to provide oxygen support, nebulized or inhaled medications. And sometimes patients can go to pulmonary rehab where they can work with a team under close supervision, monitoring their vitals and their oxygen saturation while they're doing supervised activity like a treadmill, for example. Moving on to partnering specifically with the team. So what questions can be asked? And these are sort of questions for discussion purposes, but what can I do to prepare for my treatment? Who do I contact if I have questions? What support services are available? How do I get help with managing cost? Which treatment do you recommend and why? What about clinical trials? Side effects? How can I get a sense if the therapy is effective? When do we use palliative care, dietitian, physical therapy? So these are just some helpful hints of how you can broach some questions that you might have about your cancer and its treatment with your provider, and just sort of a reminder for you. But it's always helpful, I think, to ask these questions, to have somebody come with you, and remember that you can ask these questions at any time. If you forget, you can call us. You can come in at the second appointment. You can talk to the nurse practitioner at the chemotherapy teaching visit. You can talk to the palliative care staff. All of us work together to answer the questions. We're all part of a team to make this journey a bit easier. So again, some of these things more specifically in points here: bring questions to your appointments. Write things down. I think that's a good thing. Write things down at your appointment. Write things down before the appointment. Bring a friend or relative with you. Ask for copies. It's commonplace, very easy for me. I see the patient, I'm going over a technical genetic result or their scan results. I just hit print and it comes right out to the printer. Very easy to give. Side effects. Being upfront about other medicines you're taking, I think, is important. So not only prescription meds, which are very important to tell us, but also supplemental medications, supplements that you can take from a health food store. It's important to know because some of these supplements can interact with the chemotherapy. Some of the supplements have their own sets of potential side effects. So the more we all know and work together, the better off the patient will be. And then talk to your doctor. What are my personal and my treatment goals? When you have a curable cancer, obviously people want to push the limit typically and do whatever they can to cure themselves. If a cancer is not curable, it doesn't mean that we're not going to do everything we can to help and to control the cancer, but the goals may be different, and what somebody is willing to accept in terms of side effects might be less if they're living with their cancer as opposed to curing it. What are your goals and values? So again, some kind of questions for thought. Physical health and well-being. What's important for you to be able to do? Sometimes cancer is going to limit what you can do. Sometimes the treatment will. What do you want to be able to do for yourself, for your family? What's important in the lives of your family members? I want to get to a wedding. I want to get to a certain event. I want to feel well when I go to that wedding. These are important things to review. Do you want to work while you're on treatment? Sometimes it's very feasible. Sometimes people need to take a bit of a break. Sometimes people need to have a modification of their work. And all of these things need to just be discussed. Disability, retirement, those are things that should be reviewed. Are you getting the support from your community? How can you stay involved? Again, the cancer support community is an excellent support system for patients with cancer, but there are other community resources and that can help patients be involved and feel like they're staying kind of relevant. And then what else is important to you? So members of your healthcare team, as you can see, doctors, other healthcare providers like PAs or NPs, nurse navigators who we have here in all of our cancer disciplines. We have a thoracic nurse navigator, Amy Lowe, who's in the program at Torrance Memorial for our lung cancer patients. We have pharmacists, social workers, dietitians, therapists, palliative care, complementary and integrative medicine. I'll give a push for Susan Starr, who's our nurse practitioner, one of our nurse practitioners at cancer care at the Hunt Cancer Center at Torrance Memorial. And she is the director of our complementary integrative medicine and has really spearheaded doing a lot of innovative and integrative programs for patients, really focusing on health and well-being, living strong, focusing on diet, focusing on activity, focusing on supplemental treatments, acupuncture, various complementary things that are basically not in lieu of standard Western medicine, but help to adjunctively help the patient feel better. Reiki, essential oils, these are other things that we're implementing just for patients' quality of life. So coping with the emotional impacts and of the cancer as well as the toxicity, distress can impact many aspects of your life: cognitive, behavioral, social, emotional, spiritual functioning. It's important to know symptoms that you're having and be honest with your doctor and to pay attention to it. What are some symptoms of depression or anxiety? Well, some are obvious, some are not. Depressed mood, irritability, apathy, not having pleasure in doing things anymore. Sometimes weight loss or lack of appetite can be a sign of depression. Insomnia can be a sign of a mood disturbance, fatigue, poor concentration, being restless, and then in more severe cases, suicidal thoughts. And all of these things should be addressed, some of them more imminently with your team. It's always important to me and our team to impart optimism and hope. Optimism, positivity, hopefulness doesn't mean that the patient still doesn't have side effects and doesn't have bad days and feel negative, but it just means that we need to be realistic. So we always want to have hope, but we need to be realistic that sometimes we're going to have a bad day. Sometimes the treatment may not work as we hope it will, but that doesn't mean we give up. It means that we pivot and shift and go on to an alternate plan. And as long as patients are willing, and they're fit and feeling well enough, we're willing to have those discussions and to look at other options. We want you to focus on making decisions about your care and your life, and to find hope and reasons to be optimistic can lead to a better quality of life. What's important to you? Family, friends, going on a trip, having something, a special event to go to. All of these things kind of help us stay grounded and look forward to things. Expressing your emotions is important. People that are bottled up, repressing your emotions can make you really hostile or aggressive, make irresponsible or inconsiderate impulses or choices, and often leads to people's isolation. Whereas if you express your emotions, people typically feel better. It feels good. It's not just a saying to get things off your chest. You do feel better mentally and physically. And it gives you the ability to be in control of your life a little bit better. It gives you some confidence, makes you feel assertive. And it makes you more open to these positive emotions of support, empathy, interest, and humor. Reaching out for help. What can you do if you need help? You can talk openly with your friends and family. You can find a support group. Obviously, the cancer support community is a wonderful resource that has a lot of support groups for so many different cancer subtypes and for people of different backgrounds, different groups, and you can find something that fits your needs. Torrance Memorial has also support groups. Other hospitals have support groups using an online resource. American Cancer Society, other societies will have good supportive services for patients. Talking with clergy, if you're spiritual, that can be helpful. Speaking to a licensed clinical social worker, talking to a psychologist or a psychiatrist can sometimes be useful. Doing mind-body programs for stress relief can be helpful as well. Important ways to sort of take care of yourself include social support. Exercise is critical. Adequate sleep. Connection with others, not isolating. Processing your emotions. Adequate nutrition. Not just taking care of yourself, but also doing positive, fun, upbuilding things or pampering yourself, because you need to do that to get through these rough times. Spiritual practice doesn't always have to be religious. Some people have a higher power of some sort or relate to nature. It doesn't have to be a religious practice. Hobbies. Obviously, if you have something that you enjoy, that you can keep up with, that helps take your mind off of some of the negative impacts that the treatment is having on you. Important to spend a moment to talk about support for caregivers. So people that take care of patients living with cancer can also have some issues too. It's important to recognize changes to your own appetite and to find a balance in supporting your loved one and caring for your own nutritional needs. We don't want to neglect ourselves at the expense of our own health. We're helping our partner or our parent or our friend. If you can't be healthy, then you really you're not really very helpful to somebody else. So you really have to take care of yourself first. And you have to acknowledge what your loved one is going through so that you can avoid certain conflicts and stress by just kind of negating some of these emotions and these feelings. Remember, as I said, self-care. Caregivers need support too. Essential to go to some of these support groups. Talk to people that are in the same boat as you. Give each other helpful hints of things to do that were useful, things to avoid that may not have been useful. Using online tools like My Lifeline to help you with scheduling and such. And then communicating yourself as a caregiver with the health team so that they can perhaps adjust treatment schedule based on the caregiver's needs. If the caregiver wants to take the patient to an appointment, but they're not available at that time, we can switch the appointment. Hope is a powerful coping strategy. It lets people look to the future and get out of the negativity sometimes of the moment. As you navigate the side effects of your treatment, you should know that there are support services available to help you thrive and be involved in your community. Cancer support community resources. We have trained helpline specialists and local CSC and Gilda's Club staff can help you to create a list of questions. So that's, I think, very invaluable. Sometimes it's overwhelming. You get a diagnosis. I can imagine your mind is a blank. It's talking to people that have some experience and can guide you is really very important. And there's some information on how to do that. Here's some cancer resources, some local, some national, that you can look at in terms of getting supportive services for cancer and its treatment, and that list is available to you. My Lifeline, which was mentioned, is available in English and Spanish. It helps you connect with others, finding support, exchanging ideas. There's discussion boards. And then you can connect through a private community website and use blogs to document your cancer journey and share with others. And I think that's helpful for people to communicate with each other and basically gain a respect for other people's journeys, but also get a better understanding of things that might be helpful. And then living with cancer, assigning care coordinators to help manage your site and using the calendar can be helpful too. Cancer Experience Registry. This is an online study that aims to understand the impact of cancer in all of those aspects and identifying unmet needs among patients, caregivers, and survivors of cancer. So the findings from the Cancer Experience Registry are used to enhance cancer care, improve support, and influence healthcare policy. So there's a personalized navigational tool, and this is designed to help patients and caregivers quickly navigate to the information they want. There's a short survey, and you'll get to a dashboard that pulls information from across the site, and you can save the information and come back to it. And then importantly, it's important being an advocate for people impacted by cancer, not just as a caregiver, but at a grassroots network level to change public policy and improve resources and outcomes. When our Congress people that we elect are educated about issues that affect patients with cancer. We can help advise them and help initiate change so that we can have policies that are either created or changed to benefit the lives of 17 million cancer survivors. Advocacy can result in better care for patients, higher quality, more affordable, and it can lead to better medical, social, and emotional care. Grassroots interventions can be useful for preventative purposes. Lung cancer screening we have an excellent CT screening program at Torrance Memorial looking at low dose CT scans to catch cancer when it's early and curable. Looking at healthcare disparities amongst people of different ethnic backgrounds, different socioeconomic backgrounds are important things to look at. American Cancer Society does an excellent job at looking at this and helping stir some interest in how to make these disparities go away so that people are treated the same regardless of their background. So this community can help provide you the opportunity to get up-to-date information on key issues, be a part of a network that interacts with Capitol Hill and policymakers, and have your voice heard, and the voices heard of cancer patients and their loved ones. And so you can see how to become an advocate here. Okay, I think hopefully didn't talk too much, but I think that's the last slide. So I'll open it up to questions and answers that you may have, and I'm happy to stay around for a few minutes.
Wonderful. Thank you. Go ahead, Nancy.
Yeah, so I think we have a couple of questions here that are in the chat box, and I want to first encourage you, if you'd like to put your question in the chat box, feel free. But I also think that we are a small enough group that you could also raise your hand and we could call on you as well. But the first question here I see says, my targeted therapy medication is causing severe constipation. I'm taking several supplements that help. One of them is Senna. I'm taking 17.2 milligrams of Senna a day. Is that safe to do for 2 years, which is how long I am put on this medication?
Sure. No, it's a good
Dr.
question.
Horodner, I apologize. I see our Zoom background again. If you don't mind just going back to the slides.
Oh, okay. I can. Let's see.
On the top tab.
Sorry, I'll try to fix that. Well, I don't know.
Or you can stop the sharing. That's okay as well, I think.
Okay. Did that work?
Yes. Thank you.
Good. I thought I did that before. Apologize. So I think I still remember the question. So about Senecot or Senna in long-term use. Senecot is typically a more gentle kind of stool softener, laxative agent. I think it's okay. I think we tend to, the dogma is to probably try to not use it forever, but if you've gone through phases where you really need it to maintain a normal bowel movement and you have to take it because you're on a chronic medication to treat the cancer, I think that the balance is in favor of staying on it. Because we want you to get the benefit of the cancer treatment, but control your bowel movements regularly.
Okay, great. This next question here says, post-radiation chemo treatment, my gag reflex has become super sensitive. I'm hardly able to swallow oral meds. Will this ever subside?
Yeah, it's a good question. The answer is it will get better. And it's frustrating because everybody says that, but we're not the one living with the side effect. So the answer is it will. It's hard to give exact answers as to how long it will take, but I think just being patient is what I would say at this point. But yes, it should get better with time.
Nancy,
okay,
before you get to the next question, I had a direct message asking me to show one of the slides. So while you read the next question, I'm just going to be showing that slide for this participant.
Okay, so you'll share a slide. And as you're doing that, then I'll throw out this next question, which is there any evidence that the use of probiotics help to prevent or control diarrhea?
I think that is probably a little controversial about direct evidence. I think there are some small studies that show it, but we tend to use it regardless of whether or not there's direct clinical trial data, because we, anecdotally find that it is useful. A lot of patients, will be on antibiotics at some time, and that depletes your healthy gut bacteria. And we have these healthy gut bacteria. It's evolved like that over centuries and many, many years to keep our gut health more stabilized. So I think promoting gut health with these probiotics, I think, is good not only for digestive health, but there's some data that it might help our overall well-being. So, and does it help with diarrhea management specifically? I'm not so sure, but I think it's a good idea to repopulate those healthy bacteria, because you lose some of them when you have a lot of diarrhea.
I don't see any other questions here in the chat box, but I'm wondering, does anybody have a question where they would want to raise their hand and ask Dr. Horodner a question?
I have a question.
Sure.
I'm looking for the. So I'm also juicing. I'm the one who asked about the constipation. Taking alectinib, and I'm also juicing vegetables every day. And I'm wondering, I mean, obviously drinking those for nutritional value. How much lemon juice is safe to have or beneficial to have? I'm hearing some people are drinking, I don't know, juice of 5 lemons, and I think that's a lot. I don't know if that's even good to do. I was doing juice of 2 lemons, and then I heard that it could take down your red blood cell count, I believe. So I'm now just doing juice of 1 lemon. I mean, is this even a good question for you, or should I be looking somewhere else?
Dr. Horodner, I apologize. I muted you because I was hearing some feedback. If you don't mind unmuting yourself.
Okay, I think I'm unmuted. So yeah, I think it's a good question. I mean, I think the answer sometimes is not entirely clear, but I agree with you. I think 5 lemons a day is a lot. I mean, remember, lemons are very acidic. So remember some of those slides that we showed. All of that acid is probably not good for the mouth mucosa. It'll break down the enamel in your teeth. And the dentist will tell you those things. It's probably not great. I know it's juicing, you're not like eating the lemon, but it's probably not great in terms of all of that acid for mouth sores and those type of things, even though you're not having them maybe. But I think 1 or 2 is probably reasonable. I always tell people moderation, and I agree with you. 5 doesn't sound like moderation. That sounds kind of a lot.
Yeah, thank you.
Sure.
Yeah, thank you, Dr. Horodner. I do want to point out before I move on to the next question that there is a survey link, and we would really appreciate we get credit. We need to turn in at least 12 of these surveys, so we'd really appreciate if you fill out the survey link. When you choose the network partner, please select CSC South Bay. I realize some of you are visiting from some of our sister sites, but please select South Bay for this particular workshop, and the information is there as well in the chat box. So our next question says, since being on Tagrisso, I've been having 3 to 4 regular bowel movements a day. Is that okay? I do tend to eat fibrous foods.
I think it's okay. It depends, if you were having one before, sometimes at first it's a little bit, alarming how many bowel movements am I going to have. But if they're not diarrhea and water, they're just regular movements, I think, yeah, I think it's fine. The Tagrisso is promoting your gut motility a little bit, and the fibrous foods, which are good for you, can contribute to that too. So as long as you're hydrating well and it's not excessive watery bowel movements, I think it's fine. And I wouldn't necessarily take antidiarrheals for that because it might block you up, which is not productive.
Okay, maybe one more question. We'll take one more question. So if anyone wants to unmute themselves, I think we have time for that. Is there any other last questions here? Okay, well, I want to thank you for your time, Dr. Horodner, and of course your knowledge and expertise, and this was really, really helpful. If anyone wants a recording, please